hot day, morning, you're wearing a tight, shorts, something you not slept well, all that stuff.
Haven't had breakfast.
Haven't had breakfast. Yes, Anjuman mein to hota hi hota hai every time. School assembly mein gir jate, don't have breakfast, all that stuff. But I'm mom always fed me before going to school. I never had that. So, jab hota, first response would be, lift up that fellow, make him get up, give some water, make sure that I would say that's the wrong response. Honestly, ask that person if he or she is doing okay. Check for a pulse. More often than not, it's a vasovagal attack. Okay? In the sense, we have blood vessels going in our brain. Sometimes we just have a little bit of blood which is deficient to our brain. So the body has a physiological response, collapses and falls down so that blood can gush to the brain. So instead of or lift them up and get up, you can ask them to lift the legs so that more blood rushes to the brain. So this is the most common. 90% of the time it's a vasovagal sort of episode, especially in young, healthy children. Sometimes we will teach you how to assess if it's that 10% which is not. So when you hear who falls, you think of what animal? When you think of who falls, when you hear who falls, you think of
Old person.
no hoops. You think of horses. So most common thing, common things are common is what I'm trying to say. When you hear who falls, you think of horses. Common things are common. So when you hear those sort of, you see the mind does not know. I mean, the mind does not know. What the eye do not see, what the mind does not know. Okay? This is an old adage. If you know, you had experience in the past, and you're aware of what a vasovagal attack is, then you'll be able to give that response of lifting up the legs. That's basically the moral of what I've told you today. So without further ado, we talk about basic life support. We have a nice program planned out for you. We have our trained ER physician as long as my long-time colleague now, Dr. Setu Murugan. He will guide you through the basics of basic life support and emergency response, especially when a person collapses. So how do you become a responsible first responder? By no means is this a comprehensive course. By no means are you guys anywhere expected to be in an ER. This is just for you to respond to an emergency. Suppose railway platform is going to be irrigate, you should know how to do 1, 2, 3. First, go make sure that the patient is actually conscious, make sure that the patient is awake. Go ask him, sir, are you alright? Actually, first you ask him, tap him, make sure that he's alert. If he's still not responding, what is the next step? You check for pulse. You see if he's having a pulse. Then he'll tell you exactly how to palpate for the pulse and see whether he's having a heartbeat. If he's not having a heartbeat, then you need to do the next step, which is CPR. This could actually save somebody's life. Alright? Unfortunately, you might have all been exposed to the videos of what happened in South Korea on Halloween. So there was a mass gathering and they all got sandwiched and crushed. Not any different from what happens in Hajj very regularly, where they all trample each other. Many of the times, people survive because CPR is administered. Because for those few moments, they get stabbed, crumpled, their ribs collapse or their heart gets compressed. CPR could just keep them alive for that moment longer for them so that they can get to a hospital or they can get actual medical treatment. For those few minutes, sometimes even 5-10 minutes, you could, prevent things from becoming worse. So, without further ado, this is Dr. Setu Murugan and our trained BLS responder. He is our first responder. He is Mr. Lokesh. He is a physical fitness trainer. He has been associated with me for the past 5 years. He's done a lot of physiotherapy and also for people who have had disabilities and damages, ligament tears. He's a specialist in retraining and a rehabilitative specialist. So both of them will take you through the entire BLS first responder course and also some basic home remedies for small, say an insect bite or say for example someone's having a fit, a seizure, how do you respond to all of that? And choking, they'll give you a small insight. By no means are you given the burden or the responsibility that you have to do this. You're not even certified. I will give you, definitely you will receive a certificate, but by no means is this a major responsibility on your head. It's just an awareness. If you are interested, definitely we can organize something where you will get a certification from the American Heart Association or an Indian Heart Association. That is the next step. Alright, if this does interest you, it's piqued my interest. This was the reason why I jumped into this field. How to save a life was, that's the first step. Huh? So, yeah, so Alhamdulillah. Yes, ma'am. Yes, ma'am. Yes, ma'am. Definitely we will have that, we will focus on, that's why I took that example. Because all of us, we have exposure to a lot of children. We have exposure to 800 children almost on a regular day-to-day basis. And yeah, that's something which we should focus on. And we will definitely shed more light on choking, falls, injuries, insect bites, fits. All these are very common in younger children. Like a febrile seizure. It might be absolutely terrifying to see a newborn or a infant or a child, a 3 or 4 year old, 5-year-old child. What do? How do you respond to a seizure happening in a child? It really throws you off guard. But more often than not, febrile seizures which happen during fever, are the most benign entity. When you bring the temperature down, apne aap, by itself, are they poido? You just have to do good amount of tepid sponging. If that seizure is not stopping, you need to get to make sure that they don't. Some people, it's a home remedy. Unfortunately, I don't know how this came about. Maybe you could shed light on it. Metal, make him catch a key or a rod or something. I've seen people come with injury. They poke it into the head, they hit it. So that sort of situation that's wrong. Don't seizures so long. They'll move their hand like this, they'll move their leg like that, they'll vomit sometimes, their eyes will go up. So instead of injuring them, they might have tongue bite also sometimes. So you can put a piece of cotton or a gauze in the mouth to prevent them from biting their tongue. Keep them in the left lateral position so that they don't aspirate, they don't take in the saliva back. Make sure that they're in a safe environment, let the seizure go. And try to get the temperature down as fast as possible. Take nice tepid sponging, put a paracetamol, call an ambulance, get to a hospital. Better to manage the febrile seizure in a hospital. Always better to get to a hospital to treat a febrile seizure. Alright? Sometimes febrile seizures, they can be a harbinger for something worse to come, but that is very rare. Sometimes febrile seizures would mean that the child has a neurological disorder, but we don't see that. We don't see that very commonly. It's more just a passing phase. When they grow out of it, 5, 6, 7 years old, the incidence is very low. When they become teenagers, it's almost none. Yes. No, it should be cold. Cold one. No. It should be like maybe 24 degrees would be a very good temperature. It should be like ice. Some people do keep ice also. They do keep ice also. I've seen cooling happening that way. But I would prefer, it's a debatable sort of thing. Sometimes the child may not bear that much cold also. So 24, 25, she's already, the temperature, the body temperature goes up to maybe 40, 41 kg. You can't expect them to tolerate 18 degrees or ice, 0 degrees. Rather you keep 24, 20, 22, 23, something like your, and I have to tell you something regarding both your air conditioners, not for our children, because they sleep with the fan and all that stuff. The children in our homes, please try to avoid temperatures below 24. As a thumb rule, do not keep your AC at 18, 16. Never. It is something which causes respiratory issues, definitely, sinusitis, definitely, also heart disease, laziness, metabolism slows down. You will have difficulty waking up children in the morning. This is something which will get me kicked out of the mainstream. So I have certain civic responsibility. I can tell you, you guys can go take it up with the men. Okay, I'll take it. So definitely temperature of 24 is ideal. Also it is cost effective for your ACs. If you run it at 24, you're going to consume less units of power as well. So your electricity bill also comes down. And definitely the battle for Fajr will be won on a fan. Battle for Fajr, if you want to win, sleep with fan. You will win it 8 out of 10 times. Battle for Fajr will be won from a fan. So lower the temperature, higher incidence of respiratory disease, higher incidence of heart disease, slower metabolism, more laziness. All these factors come in when you have very low temperatures. So try to avoid it. So avoid that as much as possible. Try to keep it at 20. I'm not saying sleep always in fan. If you like a bit of comfort, well and good, no problem. But throughout the night at 16, throughout the night at 18, it's something which is either your AC is not working because it's showing a wrong value. 18, 16, that's not normal. 24, see your body temperature. What is your body temperature? 38.4. How can you be at 18 degrees all night, man? You get hypothermia. The AC is not working probably. Get it clean, get it filters checked. See, all the more. If you have an AC which is being set at 18, 16, it's not cooling, your filters are clogged. Do you want to be breathing air which is being pushed through dust? Make sure that your filters are cleaned regularly. Make sure that you get your ACs checked. Not by us, we just go wash it and then make sure that thing is as wet as possible in cold water or ice water, then put it and then acha marka. There's something wrong with the unit, there's something wrong with the gas, there's something definitely wrong with the filters. Make sure that the guy, the AC mechanic comes, you have your annual maintenance or your pipe, every 6 months if you have a maintenance check. Yes.
You said that with lower the temperature, it's bad for the heart and all.
Yes.
What happens to the people who are living in countries that are having...
Good question. So when you have, if you have an ecosystem, like say, for example, hilly areas, you have temperatures of 18, you have 16 on a common day-to-day basis. If you do check their hemoglobin or you check their, this thing is different from what is there at sea level. One, northern countries, the more you go higher up north, their physical activity and their exertion also is double. They need to burn more calories to stay warm. So basically, what is the meaning of a calorie? No. What is the definition of a calorie? Anybody? Exactly. The amount of heat which is required to raise the temperature of a certain amount of water by 1 degree Kelvin. That's why the calorie comes as K. If you see any Kellogg's K kilocalories, K calories. So it is a scientific definition. That's what a calorie means. So it's basically the amount of energy, ATP, which is the glucose molecules to be burned to generate heat to raise your temperature. So you need that much calorie. So all these things are small physics snippets. It sounds fancy, but it's actually the root thing is it makes sense. So if you're going to be burning so much to stay warmer, your requirement is also that much more, and your body also, your metabolism will be at that peak level. If we do go to cold countries, we'll end up getting, many times when people shift over from India to maybe North America or Canada, the first generation suffers. They usually have an early death. The second generation there, longevity is better. because they're not accustomed to it. They work double hard because of the established, the stress factor comes in. They have no one to depend on usually. They usually, I'm not saying this is just like a generalization, it's not very specific, but usually it happens that they have earlier mortality. So first generation, it also happens to different cultures. Say, for example, you go to Japan, they have a different type of diet. They have a lot of sushi, they have a lot of burnt things, they eat charcoal grilled, fried, and all that stuff. Maybe the dietitian cooks as extraordinaires can throw light on what Japanese cooking is all about. But when they did research, they found that the incidence of gastric cancer is far greater in Japan, especially for those who are transferred, who are immigrants. Their genetics are not adapted to the kind of chemicals which happens to their food. So also another home remedy or a home sort of awareness, try to eat local, try to eat items which are grown around your vicinity. This is something taught to me by my rheumatologist, someone who specializes in immune system. Growing paddy fields almost everywhere. We have only rice which is different. If you adopt more of wheat or things which are not grown locally, we end up seeing more incidents of gluten sensitive enteropathy. You have skin allergies, eczema, all these because you're not eating locally. You're importing your substances just because it's a food fad or something like that. You start taking in things which are not local to your area. Sorry? Honey. Yeah. Try it again. Yeah, New Zealand, Manuka honey, you get it from Poland. Fancy stuff. But again, those Poland grains, all these things are generated. We don't have much idea. And how it's transported, stored, and then again reheated or thawed or made fresh to us, we don't know. So try to eat as local as possible. Maybe that might help in reducing allergies. So with this overextended welcome, I don't want to take too much of your time. Stay to you.
Good morning, everybody. I appreciate all of you for taking your time and coming over here. I would definitely make sure that you learn a lot of things that may happen in your life, that you may come across any medical emergency, that what you are supposed to do as a bystander. So you might be next to the patient, the patient may be your relatives or maybe your close one or friend, what you are supposed to do. So some of the conditions, medical emergency, the definition of medical emergencies is if someone collapses, if someone is not responding, if someone had accident, is bleeding profusely, or someone BP is too high, somebody is having very severe chest pain or abdominal pain that he has never had in his life, all these are supposed to be called as a medical emergency. Okay, so I'll start with basic life support and then I'll take you to some condition which was listed of today's topic. So first, the basic life support is, way back they initiated this process. A lot of patients, they had cardiac arrest, meaning that the heart stops pumping, they collapse, they don't respond. That happens especially when your heart is not receiving a blood, meaning when your heart is not receiving blood, it's also not receiving the oxygen. So the heart stops, then they collapse. So if you are nearby to someone, what would be wondering? You wouldn't know what you're supposed to do. So they made a scientific protocol for not just for a healthcare practitioner. You don't have to be a nurse or doctor to deliver this process. You can be anyone. You can be a graduate, non-professional, non-medical. You can be a layman. And if you are good at doing this, you can definitely save the patient. You can definitely save the patient if you have learned to do this. So basic life support is when somebody is not responding. Imagine.
Alright.
Imagine you are seeing a patient, somebody is on the road, you are in the park or in the station. So all you need to do is 4 or 5 steps that I'll just make it very short so that there's too many things I should not load you with. You may not be able to remember. So basic life support is not meaning you don't have to give injections or medicines, you don't have to do ECG, you don't have to look at the ECG and tell you. Anybody can interpret. Basic life support is when some victim is not responding, you have to do a pre-hospital care. So if you do this pre-hospital care properly, by the time the ambulance comes, you take him to the hospital, the chance of survival is high, close to 50-60%. There's a lot of studies across the world is done has shown that if any victim is arrested out of the hospital or the company, any public places, if you do this process, there's chance of survival up to 50%. Meaning you do the CPR properly, you assess the patient first, you do the CPR, then you call the ambulance, tell the ambulance some victim is arrested here, please come over here, tell them the address, they will come. By the time ambulance comes, these are the things you should be doing it. So why we do this chest compression, I'm sure you would know what is chest compression. If you not, then I'll explain. The purpose of doing this is your heart is a pump. It basically pumps the blood that comes to the heart. Heart is just a pumping organ. So what it pumps is the blood. The blood has oxygen and the blood has carbon dioxide. So oxygen exchange happens in the lungs. We breathe in, we breathe out. The oxygen goes in, carbon dioxide comes out. So this exchange happens in the lungs. So when the blood goes back from the lungs to the heart also delivers the blood to heart as well as other organs, especially to your brain and all other organs. So brain and heart is the most, they are very, very highly sensitive to oxygen. If oxygen is not received by these two organs even few seconds, there's high chance of all the cells will start dying every minute and second. So when you compress the heart, when you compress the chest, basically you're compressing the heart. So when you're compressing the heart, your blood and oxygen goes to the brain as well as the heart. So just by doing that step, you are able to give the oxygen to the heart as well as the brain. So if that is not being done, what happens if it happens 1, 2, 3, 4, 5 minutes? Eventually, a lot of cells in the brain and heart die. Even if he reaches hospital, doesn't matter how big the hospital is, the chance of survival is poor. The chance of survival could be just less than 10%. You may not make it. So these are the reasons why we do CPR. When the heart stops beating, when the lungs is not functioning, or it could be both, the heart and lungs, both stop working. So that is where you have to start your CPR. So actually, who makes these guidelines? Okay, if somebody is not responding, who are the organization who gives these guidelines? It's called American Heart Association. There are other associations, but primarily the whole world follows American Heart Association, which is a non-profit organization. They make these guidelines day by day. They have a lot of data and they do a lot of analysis and studies when they bring this guidelines. So this is the CAB approach, we call it CAB, CAB approach. C stands for chest compression, A for airway, and B for breathing. So they say it's a circulation. Circulation means when you are giving chest compression, the blood circulates. That's why it's called as a CAB. Remember the mnemonic is CAB. Start with chest compression, look airway, breathing, I'll tell you what you're supposed to do. So CAB is the mnemonic of. So that is how you are supposed to do. I'll ask Mr. Santosh, he is our IC technician, he will describe you how you, first step is, you tap the patient's shoulder.
Are you okay? Are you okay, sir?
Very good. You have to be loud, you should not take his leg or head or arm. You tap if he or she is the victim's shoulder and if they are not responding, that means something is wrong. Seriously wrong, they are not responding. Irrespective of the cause, you should check for the pulse. You tap again.
Are you okay, sir? Sir, are you okay?
Yeah, whatever language you can call him. If it's not 2-3 times not responding, straight away you have to look at the carotid pulse. Carotid pulse. The pulse we would have heard. You can feel the pulse in arm, leg, and drawing everywhere. But this pulse, the carotid pulse, is supposed to be the most accurate. It's supposed to be the best one to check at emergency condition. I'll show you how this carotid pulse. So, if this is the neck. The feel of the neck, go right or left, either only one side, and you try to feel with 3 or two or three finger, just for 5 to 10 seconds. You try and feel for 5 seconds. If you are able to feel the pulse, that means the patient, his heart is beating. But you have to, in emergency situation, you can't be learning this. So after this lecture, you can try with your friends or colleagues, but make sure don't. That's it. You are hanging. Make sure you use your 2 or 3 fingers only one side. Okay? Rather than saving him, we should not do it other way around. Okay? So just check one side. The guideline says 5 to 10 seconds you should be checking that. Not more than that. Because if you are going to keep your finger for 1 minute, 2 minutes, 3 minutes, you will be wondering whether the pulse is there or not. I am not sure. Then every minute, the heart and brain cells keep dying. So that's not the point. So if you cannot feel it, no problem. Straight away the next step. The first step, check for a pulse. Second, you straight away start the chest compression. So start with compression. This is the airway and breathing next. So this is how it happens. Someone's just lying on the surface. What do? You will have to, because you can't. If you're with a lot of people, then it's good. If you're alone, you have to call the ambulance. See, this is another important thing. If you're in a country like US, you call 911. By the time you disconnect the phone, the ambulance is there right away. But here it doesn't happen. 108 is, though 108 we have pretty much, I think across the state we have. But people hesitate to call because it's government ambulance. So if you are that case, you better keep minimum 3 to 4, 5 hospital ambulance number, including Oxymed, whatever hospital that they are best or they are good at doing the services. Like you save your friend's number, you have to make sure that you have 3, 4 ambulance number, because by the time you Google it, the Google may take you to wrong number and it's not reachable, whatever. So make sure that the ambulance number is functional. And you keep 2, 3 numbers, you call the ambulance straight away, and in this address the victim is not responding. Then the ambulance also will alert, they will be on the way. And on the other side, you just a step-by-step approach. So now assess the response. He's already explained how do you, he's not responding, he's not alert. Check the pulse. Next step, start the CPR immediately. So CPR, how do you, have you ever given anybody a CPR? Okay. So how to start the CPR? See, remember the heart is on the left side for all of us. In rarely some us call it dextrocardia, the heart is on the right. We don't know that thing. But imagine most of the heart, billions of, we have 8 billion people, most of them will have only heart in the left side, okay? So you recognize the left side, and you keep your hand like this and make sure that you are positioned just above the heart and chest in this way. Just in its way. Yeah. So you have to fold one finger on top of the other one. It should be like that. Some people just keep it one side, then keep it like this, then keep it like this. That's not going to work out. If you want to give effective CPR, your hand has to be like that. Start compressing. So how he gives CPR, the joint should not be folding it, and you have, come on. He's well balanced on the victim, his joints are not folded, his back is supporting him, okay. He's also comfortable, most important thing, because you can't be hanging and giving a CPR, okay. He's also very comfortable. Yeah, ideally very good. So now the victim is on the surface, it's fine, because he's flat, he's supposed to be in supine position. If he's in chair and sitting on the other side, you can't give him a CPR just by sitting in the chair. Okay, make him on the surface or a good bed. That is the most important thing. The surface is important when you give CPR. And how much CPR you are supposed to give? So, start 1 second. There's one cycle, what we call as 30:2. 3-0-2 is the mnemonic for giving CPR. 30 compression and 2 breaths. Can you work with 2 breaths? So it's giving 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you don't have to keep counting the number loudly, but keep in mind approximately 30 compression. So you still continue CPR, you give 2 breaths. So what happens, you don't have ambu bag in the park, you may not get anywhere. Even I have seen the AED machine which was locked in the airport. So that means nobody can use it, though it is there, that's all. So this ambo bag you will not get. So that is where the oxygen comes. So if you don't have that, what you are supposed to do, I'll tell you that. So you give 30 compression, 2 breaths. 30 compression, 2 breaths. How you are supposed to start? Put your arm, your both arm in the left side of the patient and start compressing. You should not be balancing it. Your elbow should not be folded the way, it should be straight. And the force should come from your back. And you have to be comfortable. So you start this 30 compression and 2 breaths. Okay, in a minute, in a 60 second, you can give up to 100 to 120 compression. So the compression, how you compress, how much you compress, what you do is important. Okay, this way. So it gives, it goes approximately 2 centimeter or 2 inches. If you do it too fast or too slow, it may not be effective. Slow. This doesn't work. It's not an effective CPR. So in order to do effective CPR, the compression depth is important. The chest should recoil back. Okay, and the force you apply on the chest is important. Someone is very weak or lean, overweight, they may not generate so much force, but once you start training, once you make sure you are fit enough so that you can save a lot of people's lives that may you may come across in your life. So now I have told what is chest compression. So you start with 30 compression, 2 breaths. So 100 to 120 compression a minute. You keep continuing till the ambulance comes. You are not supposed to interfere. There should not be any interference. If you are compressing, if somebody else comes to you, maybe you can exchange, but there should not be a delay, or there should not be exchange. When somebody is coming, you keep it just without compressing for a minute. It may again it may lead to ineffective CPR, meaning you may not receive adequate perfusion to brain and heart. So keep continuing CPR until the ambulance comes or a healthcare provider arrives. So I said 30:2 is the mnemonic for the chest compression. In a minute or 60 seconds, you can do compression up to 100 or 120 times. Not more than that, not less than that. So the airway part is, if you have, for example, you are in international airport or any big places, I think now the government policies to keep all the important things. If you find it, if you are able to get that, you can use the ambo bag, or can give. Otherwise, you have to use mouth to mouth. But there's still a lot of controversy whether we can give because of the pandemic, viral infection or bacterial. They are worried if the person who is going to give air freight mouth to mouth, he might have contagious or other infection. So in that case, some guidelines says you can use some cotton here or some cotton if you have it. Put the cotton top of that. You can give 2 breaths. Okay. This is how they give mouth to mouth breath. So again, high quality CPR is important. You recognize the victim is not responding. You check the pulse. Okay. See, mouth to mouth. If for example, if they're your relatives or friends, they don't have any active infection. You know that they don't have any active infection. They are okay. So you can you close his nostrils, close the nose, and you keep one cotton. Yeah, that is how you are supposed to give 2 breaths. Okay. So the first step is the victim is on the ground, is not responding. Your tap him is not responding, is unconscious. You check for a pulse. Carotid pulse is the most important. You don't have to check for a radial or femoral or any other pulse. Check for a carotid pulse. Make sure you're checking only one side. Use your 2 or 3 fingers. Up to 5 to 10 seconds, not more than that. If you are not able to feel the pulse, because it's all you have to use in day to day, checking the pulse. Sometimes it may be weak, but you will not be able to feel it. If you are not able to feel the pulse, it's fine. Don't delay that. Straight away start the CPR. CAD, CAB is a mnemonic again. Start with chest compression. As I said, 30:2. 3:2. 30 compression, 2 breaths. 30 compression, 2 breaths. 60 seconds or 1 minute, you are supposed to give 100 to 120 chest compression a minute. So you continue until the healthcare provider comes, until the ambulance. Yes, you can definitely. If he is a bypass patient or is a post-transplant patient, you can give
Alright.
You can give chest compression. Nothing will happen to the stent. Stent will remain in the arteries. You can definitely give CPR. So these are the patients, if they already have a heart disease, morbid obesity, diabetes, uncontrolled, chronic smoker, they are at high risk of developing this kind of heart attack at any point of time in their life. Most likely, it can happen, potentially anybody can have heart attack in their life, but the risk factor is pulmonary artery disease, meaning that if there is a block in the artery, or chronic diabetics more than 10 years, chronic hypertension more than 10 years, if they are smoker, if the bad cholesterol is high, if their lifestyle is also bad, then definitely they are at risk of developing heart attack. So when you're giving CPR, not too fast, make sure not it's too hard. So this is 100 to 120 minutes seconds, 5 to 6 centimeter deep. That's a deep, you should go 2 inches. Continue until, as I said, these are the AED machines. Again, this is advanced cardiac life support. This is only for the healthcare providers to know the AED pad that will tell you whether the patient needs a shock or not shock and give CPR. That's it. The AED machine will tell you, put the pad, it will tell you shock or don't shock. Don't shock, just continue CPR. That's it. If it needs to be shocked, it will give you automatic, it will give the patient automatic shock. So some of the complications what was reported when you give CPR, effective CPR, especially if the patient is very weak, right? Then there were incidents reported that hip fracture and they had aspiration and gastric distension, all that after CPR. That's fine. So now I have explained if somebody had heart attack, what you are supposed to do. The next medical emergency, you may see someone has severe chest pain, profuse sweating, or shoulder pain that may indicate whether this patient is having coronary artery disease or is going to develop heart attack. So you don't know which patient will have block in the artery. It is just a food that he had and he developed gastritis chest pain. You don't know. So there is two ways to understand. If again I said if they are diabetic, hypertension, smoker, cholesterol is being higher side, if they have severe chest pain, especially on the left side, if they develop sweating, the pain is moving from chest to the arm, if they're finding breathing difficulty, that's a typical or classical chest pain symptoms. But doesn't matter, somebody will have like dental issues, jaw pain, they just feel like uneasiness, they feel a little bit of sweating, short of breath, giddiness, vomiting. It may not even, the symptoms may be like non-cardiac pain. It's like a gastric pain or vague symptoms, but you can still have heart attack. So one, you should know if somebody says chest pain, whether it's a cardiac or non-cardiac. You are only going to imagine. Doesn't matter. You cannot, because until you do ECG, blood test, echo, angiogram, nobody can assure you that this is a cardiac or non-cardiac. So if it's a cardiac, remember, even if it's a gastritis, we always do ECG to make sure this is non-cardiac, because gastritis is not going to take your life, but heart disease can take your life. So any chest pain, considering the risk factor, if it's elderly, you should reach hospital as early as possible. Preferably the hospital which has got all the facilities, like cardiac facilities, especially in our setup, we have everything what is needed for chest pain patient. So you cannot go to some alternative clinic or a clinic that has just ECG, they will send you to other hospital. By the time you go around, something will happen in the auto. Unfortunately, most of the patients come to the hospital by auto, not by ambulance. So that shouldn't happen. So if they have real chest pain, you take them to a better hospital which has all the facilities. Other than that, don't think yourself, this may be gastritis, I had some bad food. No. It can be anything, provided you go to the doctors, meet the doctors. Even there are many physicians actually they are not taking ECG, they will just give you injection and go out. Tell the doctor, please take an ECG, make sure everything is normal. Even if it's failed to do, you make sure that the doctor takes the ECG, that will have 80%, 90%. Even ECG 100%, I cannot tell you don't have block in the heart, but I can tell you don't have heart attack. Okay? The next thing is the trauma. If you have major injuries or minor injuries, if you come across any bleeding manifestation, or you happen to have yourself injured, what you are supposed to do rather than panic before you go to the hospital. Just make sure that if there is any clot or debris from the wound, just take it out and help the injured person to lie down. He is not sitting or walking around too much, it's not tense. And if you have gauze or bandage, just try and apply, put pressure, the bleeding will gradually come down. Unless if they are on blood thinners or if they have something like hemophilia, the bleeding may continue to happen for some more time, but you don't have to worry because he's on blood thinner. He is expected to have, bleeding for some more time than normal people who are not taking any blood thinner. So big trauma, if the head injury, bone is broken in the middle of the road, or you're just driving a car, you have to stop and try to help him. There are a lot of people I have seen they just put the top gear and go when they see this incident. It shouldn't happen. Okay? So it doesn't matter whether you are able to do small thing or big, you don't have to be helped. Just stop the vehicle, just go there and call the ambulance, give them your details, or try to give their details also. So give them your details. In trauma, we have 5 steps: airway, breathing, circulation, disability. Again, you in the middle of the road, no oxygen, you don't have C-spine protection, you don't have anything, but all you can do is better. Especially if there's head bleeding, ENT bleeding, you need to try and use the cotton or gauze, whatever you have, you try and compress the region, make sure the victim is in on the surface and he is not congested with a lot of people around. And definitely you have to call the ambulance. Again, keep the ambulance number, whatever hospital you know very well that they have highly equipped to treat any trauma. Cardiac hospital, trauma is again a trauma center. It's totally different. So multi-specialty, they will always have all the facilities. So if you are hesitating, call 108, call the ambulance private hospital number that you know. Okay. Next, the seizure. Now I will tell you pediatric population what you are supposed to do, adult what you are supposed to do. So seizure happens due to a lot of reasons. In pediatric, usually due to any infection that causes the temperature to go down. When the temperature go down, the brain, the neurons, the brain cells called the neurons. It functions abnormally suddenly because of the high temperature or sodium may go up and down and they get this febrile seizure or due to infections. So if it's near, like you are living in Chennai, I think it's fine. But if you are in a rural area, by the time you take to the hospital, you take to 30-40 minutes. Okay? More than the baby, you start crying. That shouldn't happen. So if it's a pediatric population, what you are supposed to do is you place the baby on the left side. You turn the boy or girl to the left side. Make sure the mouth is open because whatever saliva is there, you will try to swallow. Rather than going to the stomach, it will go to the lungs and cause aspiration. That may be one problem. So turn the baby on the left side. And again, you don't have oxygen, you don't have medicine to give, what you can do? You have to call that. We call the ambulance, arrange for a good transportation, take the baby to the hospital. Don't give, as Dr. Hama said, don't give anything steel or metal. It's not going to be effective. Nothing orally you are supposed to give. If you even a water, it's going to harm you in that area. If you take 10-15 minutes, is fine. You can take up to 5 to 10 minutes to the hospital, whichever is closer by. If it's a febrile seizure, they'll give you, again, you can apply gauze. With normal water, you put the water and just apply in the forehead, lower limb, in the groin, this 5-6 region, you apply the gauze. Wet clothes also fine, you may not have gauze at home. Wet clothes you can apply in 5-6 regions so that the temperature comes down. When the temperature comes down, the baby will have that seizure will also most likely come under control, but they will still have that abdominal movement in hand, tongue, something like perfusion will also be there. But once the temperature comes down, the seizure is also most likely it should come down. So what we do is, when you have done everything, what we just come and we give maybe suppository rectally for the temperature to come down, probably one injection to stop the seizure. That's it. Our job is also very simple. That you do all the things before you reach hospital. And choking, this is very important. What is choking? Is you happen to eat something, especially the kids. You happen to eat something, they are not conscious they are eating. They might be looking at television, they might be focused on something else. Instead of going to the food pipe, it may go and stuck in your airway where your oxygen goes in, carbon dioxide comes out. If that gets blocked, they cannot respond. So you say, are you choking? They will not be able to tell anything. You will have to recognize they were having something in mouth and they choke. So there are 2-3 steps you can do to just save him in just a minute. Okay. You have to hold the hand. Hold. Hold the hand. Yeah. So the victim has to be like that. If you're helping, you should be behind him. Use both the hand. Yeah. Blow. You have to press both the. Probably lifting and press it with both hand. Whatever object is inside, it should come out. You can blow 4 or 5 times. It should come out. If it's a kid, again. If it's a kid less than 5 years, you have to lift the baby and the face has to be a little bit facing down so that the object comes out and blow behind. Just yeah, just behind the bone, in the middle of the bones, behind your ribs. You can do it 4 or 5 times. The object usually comes out. That's it. That is the basic step when somebody is choking. Okay, so you have abdomen pain. If you see anybody with abdomen pain, rather than thinking it's gastritis, rather than taking ginger and garlic. So how we work out is there are 4 regions in your abdomen. Right side is this one, and this is the left side. This is the lower right lower. This is left lower side. So depending on the pain, we know that it may be a gallstone, it may be a kidney stone, it may be appendicitis, it may be if they are carrying, if they are a woman who is a childbearing age, if they are trying to become pregnant, we know that it may be something like ectopic or another process. So depending on the age, depending on the gender, depending on where the pain is, depending on the associated complaints, there are a lot of other disease that is associated. So as I said, this could be the reason: appendicitis, cholelithiasis, and intestinal obstruction. All that you have abdominal pain, but you have only pain and vomiting. That's it. Don't self-diagnose. Self-diagnosis is the bad thing that happens. At Googling it, Google will tell you 200 diagnoses if you type abdominal pain. That may not be right. It will not be definitely right. So reach your gastroenterologist or a GP nearby. Claim that you have abdominal pain, and he will, as I said, he will look at your pain, which region the pain is, associated factor, your profile, your age, your gender, your history and everything. Then he will come to you. Most likely you may have. He will advise you to undergo few tests or whatever to make sure what pain it is, and he will take care of it. Because I've seen a boy, I think last month, 7 or 8 year old boy. He happened to have middle abdomen pain. They used to just give him a Dolo 650 for a month, and they gave him some home remedies. The pain subsides. When it was really severe, we did a CT scan. The stone was bigger than almost the size of the kidney. So the kidney was not functioning. So when you have 1-2 days symptoms, fine. But 3, 4, 5th day, definitely it's time to see a doctor. 1-2 days fine. But don't tolerate pain so much saying that you take this tolerate. You have multiple times recurrently. Make sure that you see a doctor and it has been ruled out. No other problem. It's just gastritis. Then they give you gastritis medicine. You can relieve that. Because all the pains are not gastritis. Maybe a lot of other factors. And insect bites. So it's very common, especially in the pediatric group. So, see, there are poisoning and non-poisoning. If it's poisoning, you have to take them to nearby hospital. That's the only way. Okay, but they say you have to knock your hand, just use the blade to cut the blood come out. All that it's not recommended. No more. No need to do anything. Just take them to a primary health center or nearby hospital as soon as possible. That's all. Call the ambulance immediately. Especially poisoning, I think government has all the facilities. Even 108 don't hesitate. Just call them. They have, even primary health center, they have anti-venom, everything. So non-poisoning, if you come across any other insect that's just non-poisonous, you have to remove the sting if there's any ticks or hairs in the skin. Wash with the soap water. The water also should be clean and good. It should not be contaminated. So wash it for 5 to 7 minutes. Continuous wash it nicely. And also if you have warm water, put a little bit of salt in that. It's like a sodium chloride, normal saline. You don't have it at home. You can use salt, not too much of salt, little bit with the warm water, and then you can throw on top of that. That also helps. Raise. Okay. And then what you are supposed to avoid. I keep telling people what they're supposed to do, but they'll do what they're not supposed to do. That's the problem. So they keep scratching it. all not going to help much. So if the pain or swelling is reduced, ice packs. Ice packs will help you to reduce the swelling, even if it's injury or insect bite or whatever. So when you are supposed to call emergency help after having insect bite, if they become unconscious, they have a breathing difficulty, they have lip swelling, they're not talking, they're not able to be given a water, any of this, definitely the insect bite has made some changes in his body. He needs to go to the hospital. The take-home message is taking a right action quickly and confidentially can make a difference between life and death. A person who is dealing with a medical emergency. Once again, thanks all of you, and I appreciate your time. I think I made your time, much useful. So if you have any of medical emergency, always Oxygen Hospital is available. You can call our ambulance. We are 24/7 available. Our team is always highly equipped to manage this condition. And if you have any of the questions now or even at home or anywhere, you can call us, connect our doctor. I am facing a medical emergency. I don't know what to do. They'll connect us. Dr. Sama, anyone who's online, they'll connect us. We will tell you over the phone what you're supposed to do. No problem. So next. Okay. So no. Any bleeding that happens, especially ear, nose, throat, nose bleeding happens in the kids because of the infection. If they have any pollen, they keep on, poking their nose, that may happen. All you have to do is use the gauze. Gauze can do everything. Just press, compress, make the body to sleep. Just use the cotton or gauze, just compress the region. If it's profusely bleeding very bad, look at the inside the nose. If there is any abrasion or laceration, you see any small swelling or something, you apply the ice and take him to ENT doctor right away. ENT bleed is very common in pediatric group, but at home you can compress the bleeding side and take him to the hospital itself. That's why in pediatric group, when you have fever and when you have this infection, early if you consult a doctor is better. Rather than having a seizure and going with the fever, rather than going with the fever, you go with the seizure. Rather than going with the cold, you go with the nose bleeding. It's not supposed to happen. So in a kid, you will be very careful. Okay. Burns, if it happens, you can use Silver X on gel is there. You keep it at home, Silver X, gauze and all that. You keep a first aid kit at home, paracetamol, betadine, gauze, all these essential things you can, if you want, I can give you a list also. So all that you keep it at home. When anything happens, you can use that. Silver X is the gel. Again a gauze. Use the gauze, just roll it around, keep compressing, elevate it, don't put it down, just elevate your finger. When the pressure goes down, when the circulation goes down, when you compress, then the bleeding will stop. See, when you have, for the bones, when you have bleeding, don't put the ointment immediately. First stop the bleeding. After a while, you apply betadine ointment. Betadine. Nothing else. Betadine is. Okay. Abdomen. Yeah. What do you want from me? Okay, I'll get it. So you yeah. I'll explain for myself. So I'm standing here. How scientifically we have divided the abdomen is 4. So it is the right, it is on my left. And then you have umbilicus. From the umbilicus you draw a line. Anything above the umbilicus and right, it's a right upper quadrant. You have liver, gallbladder, part of a small intestine, large intestine, all that is in the right upper quadrant. In the right lower quadrant, you have small intestine, large intestine, appendix and kidney, and urethra and bladder and your uterus. On the left side, you have your stomach, you have your spleen, you have your small intestine, large intestine. On the left lower quadrant, you have again the kidney, you have the urethra, you have some portion of bladder, and if you are a female, you have the other part of the uterus. So depending on the pain, which region it is, sometimes you may have appendix pain on the left side. So not necessarily. Most likely you will have right side or short pain. Sudden onset is appendix. Right upper quadrant pain, very severe, feel like vomiting, and not able to indigestion problem, or maybe gallbladder stone or whatever. So you cannot self-diagnose always based on the symptoms what you have. Better to consult the doctor ASAP. Okay. So now.
Is it the compression
CPR
Correct.
and to breathe. Without breath, we can't. The compression alone won't help the patient.
You should see, that's what the guy, you have to give, airway is important. If you're okay to give, you have to give breathe, the most breathe.
So only compression won't help.
Compression is the most important thing. The oxygen is also important equally. You should be able to get the patient to the hospital within 10 to 15 minutes.
Mouth to mouth, that sometimes they hesitate. So
Of course.
if there is an hesitation, they won't do that. Only the compression.
Only the compression. Only the compression is
So, for the
fine.
patient.
Yeah, it does. So you call the ambulance that will take the patient to the hospital in 10 to 15 minutes. You can't call the ambulance that's in Fingal, but no point. It's nearby the hospital, the place where this is happening. And the next, I would request all of you to come and take, you can practice yourself how to, because a lot of mistakes you may make initially, how to hold your hand, how much compression, and he'll explain you, how to do your things. So, I think all of you, one by one, can come and start practicing. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Today, let me give some small little tips how to look after ourselves and how to avoid going to the hospital. Majority of the diseases are cardiovascular diseases. Mostly when we use the jargon of words as peripheral vascular disease, renal impairment, absolute glaucoma, cerebral vascular disease, coronary artery disease, DCM, dilated cardiomyopathy, it is going above our head. Simple is, heart is a biological pump. It pumps about 100,000 times, 1 lakh times, circulating 6,000 to 7,000 liters of blood in 24 hours. So, in simple terms, heart is a gardener and entire body is a flower garden. If proper blood flow is going, all the organs are hale and healthy. If the blood flow is not reaching, for example, without using the technical word, if heart pumps, it does not reach the face, we call it a stroke. Urdu we say, "Samu padga baat nahi karte." If it does not reach the leg, we call it gangrene foot. Let's amputate the finger, let's amputate above knee, below knee, all this. Kala hoga, karupayichi, and the kodume pannanga the hospital, kaale eduthuttaanga. Right. If it does not reach the kidney, kidney failure. Does not reach the heart, heart attack. Does not reach the eyes, absolute glaucoma. Seriya parva illa avarku. Does not reach the brain, brain hemorrhage. Okay. What do we have to do? It is very, very simple. We have to take charge of our own health. Because people always are confident. Such thing has happened to them, it will not happen to us. Because I am disciplined. They keep embedded in their mind little bit of discipline, not out of discipline. 10 times they must have had biryani, they never count about it. But 2 days they go for a walk, they say, why went for a walk? So no, there has to be a consistent basis. Now, basically, we all know we are all designed by numbers. Today, the younger generation is not scared of anything. Not even teachers, lecturers, father, mother, anything at all. They only are scared of number. Suppose their phone will suddenly from 500 it comes to 5,000, it gives a shock. They go to a shopping complex and then they are expecting it should be 200 rupees. It's 250 rupees. You argue because they are understand number. Likewise, in our body there are numbers. So these numbers have got the threshold. What is threshold? I might pinch Dr. Setu. He is strong. He will not scream. But delicate, Ashi I can, I can pinch. The same pressure she may scream. So the threshold is what it is basically. Immediately, the name came Ashi is because I'm constantly in touch with her. Okay. So the pain score differs from person to person. Likewise, the number also, like for example, BP. BP to somebody 170 by 100 To other person it can be 140 by 100, it may give him pain. But he can't be overconfident. When the doctor says, pharmacy bill. Then from 70 it goes to another 10 mercury millimeter, he might collapse, he might have a stroke. Because what number is going to harm anyone, no one knows. So, how to avoid going to the hospital? We have to take charge of it. Look at this 5 finger. Number 1, BP. 120 by 80. There is nothing called medium value, severe value, normal value. There is only one optimum value. You got to see that. Another is sugar. Your HbA1c 5 to 6 or 6 to 7. All right. 100, 110. Fine. Some people they come to the hospital 300, 400. They never know. But ultimately they land up in ICU. Okay? You have to see your sugar. Be right. Then your cholesterol. Every good lab has got in the side, your total cholesterol has to be within 200. Your triglycerides should not be above 150. Your LDL, low density lipoproteins, should be below 100. Your total cholesterol and divided by HDL has to be 4. Okay, we cover BP, we cover sugar, cholesterol. These 3 things you have scored good marks. Then comes your some form of exercise that you should do. I'm not against gym, but mostly people get the kick. They immediately join, they buy this band, that and all that, and 2 days they go, after that it's a cold storage. Or sometimes they monocycle, they buy mostly the towel after the bath, it is put there. Or they buy a treadmill. It's a pride. I have a treadmill, I have this one. But how often you are using? I recommend mostly walking. Walking is basically, what does it happen? Every doctor says walk. Today, let me reveal the secret. It's a periphery of the heart. This is the second heart. Your calf muscles. You know the BP pump. So God has fitted 2 pumps. It's called venous pump directly attached to the heart. So heart is a fellow, you sleep, eat, do anything nonsense, but still it is constantly beating. But this calf muscle is not working unless otherwise you walk. When you walk, your blood directly pushes back to the heart. It reduces the load of the heart. Your blood becomes warmer, thinner, and thin blood reaches everywhere. So sugar automatically comes down, BP automatically comes down, cholesterol comes down. You don't have to be 100% dependent on it. So you go and see your next visit, your doctor says, fantastic. You become happy because who doesn't like compliment? You say, good, I'm going to reduce your medicine. You love that doctor. We want all our patients to love us. You don't do all that and then you come. Then doctor adds 4 more medicines. Out of respect, they keep quiet while going, our pharmacy business now, these sort of things we hear. So, walking. And then food. Food, you got to have, nobody says stay hungry. Have a good caloric watch and all that. So, stress management. All these 5 fingers join together: BP, sugar, cholesterol, exercise and food. You can punch out so many cardiovascular diseases top to bottom. 90% of the hospital will not have patients. So people say, why are you talking always against hospital? Our elders have taught, always you should wish others should stay good. If God is not going to give a source through this, He give in some other form. Our duty is to educate people, they should not become patients. So I hope you people will follow this. Not only this, the younger generation. Today the younger generation has forgotten what is walking. They go to the lift, we see it's unfortunate. First floor, they'll watch the mobile phone, a smartphone and wait for the lift. They go to the shopping mall, they go escalator. What is walking, don't know. And today the smart classes have come. Our school days and all that, we have to see, like, play in the sun, and then we get bruises, burns, so many things. But this is a part of what we became strong. But today, 8th standard, 10th standard, they want scooting. While the plus one is they want vehicles. So there is a common thing is vitamin D deficiency. To every patient, we are writing vitamin D tablets, D rice, once in 7 days, once in 8 days. So they have osteoporosis. So that means we all make a mistake. I usually tell my patients. So these are the things. Okay, there are by default other diseases come in spite of that is God's will. But most of these diseases can prevent going to ICU. ICU is not a good place. Just now I'm coming from ICU, talking to the patient. It's like, the cardiac arrest and things like that, CPR, shock and all that. And it drains the finances. So when we all educate ourselves and follow, I always say, நம்ம போகும்போது கொடுத்துட்டு போகணும், எடுத்துட்டு போகக்கூடாது. So you land up in ICU. So you ultimately you don't get any commodity. You pay a huge bills because maintaining an ICU, medications and all that is all very expensive. So if you follow these simple tips, I wish and pray all of you stay healthy and all your relatives, everyone stay healthy. So when we are healthy, our home has got a different atmosphere. Just imagine, any one person is sick, whatever it is, that home is not having really a harmonious feeling. So then the neighbor stays healthy, all the more good. The street stays healthy, all the more good. So our country stays healthy, there will be good productivity and we'll all will progress together. Thank you for your patience. Thank you, sir. So if there is no question, we can start this. All of you can come and practice how you are supposed to do CPR. சொல்லுங்க. You mean, okay, yeah, shock circuits na பண்ணுங்க. That case also you have to call the ambulance. Make sure you don't take the victim without food or something. You make sure he comes out. He's conscious. If he's not conscious, you call the ambulance right away. Just to go back and do ECG. Nearby hospital is always safe. Ambulance, where? It's whatever you use, but you are not supposed to take it physically. You have to use the wood that doesn't transfer the power. You use it and disconnect the power. It doesn't matter. You can do it and look like a slipper, but your hand cannot.
CPR நமக்கு அது வேணும் இல்லை கொஞ்சம் பண்ணிட்டு மட்டும் பார்த்தோம் அப்படியே கவர் பண்ணிக்கோமா எனக்கு ஃபோட்டோஸ் எடுத்து நான் இதை நான் பார்த்துக்கிறேன் நீ ஃபோட்டோ எடுத்துக்கிறேன் இது என்கிட்ட கொடுத்துரு ஃபோட்டோ மட்டும் யாராவது இருக்காங்க கொடுத்துரு நீ லைவ் பார்த்துக்கோ அங்கே போய்டும் அப்படியே பண்ண முடியாது
We can't take the patients away. அப்படின்னா சார் சப்போஸ் பேஷண்ட் எழுதுறாங்க ஹைட்டன் ஒரு பேஸ் போக முடியாது ஆக்சுவலாக எப்படி
No. Gimana?
Use your bone.
Not smoking body. How are you?
Leave your handbag on the
There I have to right on top of the heart or here down. No. Here. So I have to here. Right in the center. Not on the heart. So center. Lining, okay? Come this side. This side.
One minute. One minute கொடுக்குமா 30 seconds கொடுக்குமா 30 seconds count 5 minutes ambulance already கொடுத்துட்டா இருக்கு சோ இப்போ எவ்வளவு நேரம் கொடுக்குறீங்க சாப்பாடு போட்டு சாப்பிட்டு முடிச்சிட்டே எவ்வளவு 1 minute 50 press பண்ணணும் 1 second ஒரு press பண்ணணும் புரியுதா? நல்லா தெரியும்.
Very light, अच्छा. That's it.
என்ன போனோம் இல்லை போ என்ன போன பண்ணா வீடியோ எடுப்பாங்க இருங்க இருங்க எல்லா போனும் மக்கள் நான் போகிறேன் கமெண்ட் பண்ணு. ఇంటికి కుతురువా?